Hello YouTube viewers, this is Dr. Daud Akhtar on your channel The People's Doctor. Today we are going to discuss about the early sign and symptoms of breast cancer. So if you come across any of these sign and symptoms which I am going to discuss in this video, you have to consult your surgeon and he will do the further examination and further routine investigation that will be done in order to proceed further. If you talk about breast cancer or any other cancer in general which occurs in your body, the basic thing is that the earlier the cancer is diagnosed or detected, the better is the prognosis, the better is the survival rate of that patient, the much better treatment options are available, and the response of the treatment is also very good. On the other hand, if the cancer is diagnosed in the later stages like stage 3 or 4, the prognosis is also very poor, the mortality is very high, most of the time the patient don't survive, and treatment options that are available are very less, and the patient response to their therapy is also not very good. So the best thing is that you have to diagnose the cancer as early as possible. That is the best thing for the patient also. So if you can detect or diagnose the cancer at the very early stage, it is completely curable. The treatment options that are available are much superior, and the response of the patient is also very good. So in general, the best thing is that you have to diagnose the patient of the cancer as early as possible. This thing also stands true for the breast cancer. The earlier the diagnosis, the better is the prognosis, the better is the survival rate, the better is the treatment options, and almost all the cases can be cured properly. So if you talk about the early sign and symptom, first symptom is a nodule or a lump that can be seen in your breast tissue, or you may feel that lump, or it may be palpable in your breast. Now while you are just taking bath or just routine while changing clothes, you may come across that some lump is there, or some growth or some nodule is there in your breast tissue. That may be the first sign of early cancer. Now other thing is that not only in the breast tissue, sometimes you may feel a lump, or you may notice a lump in your armpit or in the axilla also, and that is also one of the signs and symptoms. Now important thing is that if you notice the lump in your breast or in your axilla, that doesn't mean that it has to be cancer. The most common causes of lump or a nodule in your breast are usually benign. It can be usually a fibroadenoma, or it may be a simple cyst or some fibrocystic disease of the breast, which are completely benign and you don't have to worry about it. But the most important thing is that you have to consult a surgeon. The surgeon will do the triple assessment, that is, he will do the clinical assessment of the lump, he will palpate the lump, and the second thing is that you have to go for the radiological examination, like you have to go for mammography, and the third thing is that the pathologist will do FNSE and he will look under the microscope to see the nature of your cells, whether they are benign or malignant, or is there any type of infection or something like that. Second sign is that if you notice any skin changes on your breast, like if you notice any redness or skin discoloration or blackness over your skin, or some color change in your skin, that is also one of the signs. The skin changes around the nipple is also very important, because sometimes you may have some skin excoriations or some flaky changes, like the sloughing of the skin of the nipple. That is also one of the early signs of the breast cancer. Now the third thing is that if you feel any enlargement of your either of the breast, one of the breast is small and the other breast is becoming slightly enlarged, or if you feel any asymmetry of the breast, then that is also one of the signs of the breast cancer. The fourth important sign is discharge from the nipple. Now the discharge usually can be a bloody discharge, it can be watery or clear discharge, or some greenish discharge or brown color discharge, or any sort of discharge apart from the milk. If you are experiencing any discharge from the breast, that is also one of the early signs of breast cancer. Now pain or tenderness in one of your breast is also one of the early signs of breast cancer. Usually the pain may be due to some infection or inflammation or some other process. So if you are experiencing any pain or tenderness in one of your breast, that also may be an early sign of breast cancer. So these were the early signs of breast cancer that we have discussed today. So you have to consult a surgeon and you have to get your tests done, routine investigations done like mammography and FNSE, to rule out the cancer. So if this information was beneficial to you, please like this video, subscribe to our channel, and share this video to as many people as possible, so we can spread this information and help people.